So now we'll quickly try to look at the next infection, and this one is infection of the bones. So this is what is known as the acute pyogenic bone infections. Acute pyogenic bone infections. Alright, so of course there's a bone infection inside here. It's just down the outside, you're seeing the swellings and everything. So acute pyogenic bone infections, right, also known as acute osteomyelitis. Okay, this refers to acute bacterial infection of the bone and bone marrow, most commonly caused by the Staphylococcus aureus. When you say something is acute, it's happening all of a sudden. So it's a serious orthopedic condition and it requires urgent diagnosis and treatment. This is because you want to prevent permanent damage. So infection usually reaches the bone via several routes. It could be hematogenous spread, it could be direct inoculation, where directly they put the infection in you, maybe the surgery materials or instruments were not neat, all those kind of thing. It could be contagious spread. So usually leads to suppuration, necrosis, and sequestrum formation. Alright. Surrounding periosteum reacts by forming new bone. That's what involucrum. So clinical features is what? Acute onset of localized bone pains and tenderness, swellings, warmth, redness over the affected area, fever, malaise, systemic toxicity, restricted movement of adjacent joints, due to pain. So it commonly affects what? Long bones. So you do all those blood tests to back up, blood cultures to back up to, x-rays, MRI, bone scans to back up. So the definitive stuff here is you actually do a biopsy, do aspiration and biopsy of the bone. Okay, then you also culture just to identify the microorganism causing the issue, so that your treatment can be tailored just to what the patient needs. Okay. Okay, so complications, it could lead to sequestrum formation, that's dead bone fragment. It could lead to chronic osteomyelitis. It could weaken the bone, leading to pathologic fracture, septicemia and systemic spread, also growth disturbances in children. So management, emergency treatment is required. So all those intravenous antibiotics, surgical drainage and debridement. Okay. Supportive care like analgesics to relieve the pain, immobilization. You also hydrate the person, and also physiotherapies.